Very good afternoon. I am Dr. Abdul Karim, working as Assistant Professor ENT, National Institute of ENT. I am dedicated to thyroid, parathyroid, and head and neck cancer surgeon. I'll talk about reducing overtreatment in low-risk papillary thyroid cancer. Cultural and economic perspective from Bangladesh. This is my short biography. I always dream all head and neck cancer patients in Bangladesh will get comprehensive treatment, world-class treatment in Bangladesh. I have no potential conflict of interest regarding the content of this presentation. Everyone know about thyroid gland. Thyroid gland is very important endocrine gland in our body. It secretes thyroid hormone and calcitonin. By secreting thyroid hormone and calcitonin, it acts on heart, GI, brain, bones, muscle contraction, and calcitonin acts on parathyroid hormone production, kidney clearance rate, and bones health. Thyroid nodule is common. This is a landmark article, a systemic review and meta-analysis, mapping global epidemiology of thyroid nodules among general population. More than 20,000 articles, 9 million people are included in this study. This study shows that near about 24% people affected in thyroid nodule, although they have no sign and symptoms. This is another article, prevalence of thyroid nodules and associated clinical characteristics. Findings from a large sample of people undergoing health checkup at the University Hospital in Vietnam. This study showed that near about 47% of the people affected from thyroid nodule. When you get a thyroid nodule, how will address or how will approach this nodule? Two basic tests: number one, thyroid hormone test; number two, ultrasonogram. Ultrasonogram findings will guide us fine needle aspiration cytology is required or not. In ultrasonogram, we will find microcalcification, irregular margin, taller than wider. Then we will decided fine needle aspiration cytology, and if thyroid nodule size is more than 1.5 centimeter, we always suggested to fine needle aspiration cytology. After fine needle aspiration cytology, this case is categorized in very low risk and high risk. If this size is less than 1 centimeter, active surveillance is now treatment of choice. And if it is 1 to 4 centimeter, hemithyroidectomy is enough. And if more than 4 centimeter or extrathyroidal extension, we usually offer total thyroidectomy, central compartment neck dissection. If required, then lateral compartment neck dissection. Thyroid cancer global burden and trends. In topmost cancer in world, thyroid cancer also one. Prevalence of differentiated thyroid cancer in autopsy study over 6 decades, a meta-analysis. This is very interesting meta-analysis. In autopsy findings, found that near about 10% of the people affected in thyroid cancer, but all of them died due to other cause not related to thyroid cancer. This meta-analysis showed how good thyroid cancer is. In day-by-day thyroid cancer incidence is high due to medical care access. Number two, advancement of imaging, but mortality remains unchanged. Sometimes the best treatment is thoughtful observation. This is a good and landmark article by University of Japan, Miyauchi and his team. Less than 1 centimeter thyroid cancer, only active surveillance is enough. Then in 2015, American Thyroid Association adopted this protocol, that active surveillance. Usually thyroid cancer is divided into differentiated thyroid cancer and undifferentiated thyroid cancer. Differentiated thyroid cancer, maximum cancer is papillary thyroid cancer. Global overview of papillary thyroid cancer. Although thyroid cancer is more high development index country, but mortality is very high in low development country due to poor medical care access. Usually in Asia country, total thyroid cancer affected people 72.7% due to high population in this area. How you diagnose papillary thyroid cancer? Usually fine needle aspiration cytology. Ultrasonographic fine needle aspiration cytology is preferred, and there is a orphan nucleus, which is a famous cartoon. Understanding low risk of papillary thyroid cancer, which is intrathyroidal, 1 to 4 centimeter or less than 1 centimeter, no vascular invasion, no distant metastasis, no lymph node metastasis, and no aggressive cytology, that means tall cell, hobnail cell, columnar cell, and less than 5 pathological lymph node micrometastasis, and is in between 15 to 55 years. Papillary thyroid cancer, sometimes low risk but high hope. Recommendation of initial management of low risk papillary thyroid cancer: hemithyroidectomy if 1 to 4 centimeter. If less than 1 centimeter, it is active surveillance. Central compartment neck dissection is not recommended. Radioactive iodine not indicated, and thyroid stimulating hormone targeted goal 0.5 to 2. Different guideline in all over the world: American Thyroid Association guideline, European, British, Japanese, NCCN, and Korean Thyroid Association guideline. Are you far away from world standard treatment protocol? This is a good study in our country from Combined Military Hospital, Dhaka. This cross-sectional study was conducted in CMS from 26 March 2021 to 21 July 2023. Total 67 patients with low-risk papillary carcinoma of the thyroid who had undergone hemithyroidectomy. Clinical outcome showed that 93% of patients achieved symptoms relief, while 88% were surgically cured with 12% recurrence rate. This study is going on by leadership of me. Clinical outcome of hemithyroidectomy and active surveillance in Bangladeshi cohort. Total 51 patients, female 59% and male 41%. Tumor size less than 1 centimeter, 1 to 4, and 1 to 4 centimeter, 47 patient. Less than 1 centimeter, we offer all patients to active surveillance. 3 agree with us, but 1 intended to or wish to do thyroid surgery. That's why we do hemithyroidectomy. But 1 to 4 centimeter, all patient, 47 patient, we have done hemithyroidectomy. Everyone else is okay. 3 went for combination thyroidectomy due to recurrence. That means we are not far away from world standard treatment. In 6-monthly follow-up, we assessed thyroid stimulating hormone, free thyroid hormone, ultrasonogram of the thyroid gland. Sometimes less is more. William Shakespeare. This is absolutely right in case of thyroid, papillary thyroid cancer or differentiated thyroid cancer. Current treatment landscape in Bangladesh: total thyroidectomy followed by radioactive iodine therapy due to lack of national guideline implementation. Patient preference for aggressive treatment due to fear of cancer. Family-centered decision, fear of recurrence, societal perception of cancer, role of traditional belief, all are cultural influences of thyroid cancer treatment. Usually when we offer any treatment, especially surgery, all patients consult with their family member, and different member impose different type of decision, and there is a false belief, and I think there is also loss of confidence regarding treatment, cancer treatment facilities in our country. This is also a major role in case of low-risk papillary thyroid cancer management. Direct and indirect costs: surgery, hospitalization, lifelong thyroid medication, a strain on the patient and the healthcare system are economic perspective to thyroid cancer treatment. Physician practice pattern and medical legal concern, limited surveillance and infrastructure, patient awareness and health literacy gap, all are challenges and barrier to adopt international guideline or international treatment in our country. A strategy to reduce overtreatment, promote American Thyroid Association guideline adherence, or establish local guideline, strengthen multidisciplinary tumor board approach, educate patient and clinician, introduce active surveillance protocol, incorporate ultrasonogram follow-up and cytological re-evaluation. Future direction, building a national thyroid cancer registry, guideline adoption, educate patient and clinician, promote shared decision making, use telemedicine or online for follow-up. Reduce overtreatment to improve patient quality of life and reduce cost. Encourage policy support and public awareness. Low-risk papillary thyroid cancer, excellent prognosis, overtreatment offers no survival benefit. Cultural fears, economic realities must guide management decision. Adopting evidence-based cost-effective approaches can improve care equity. Reducing overtreatment saves cost, improves quality of life, and is globally relevant. Bangladesh has the potential to lead in balanced patient-centered thyroid cancer care. Thank you all. I express my heartfelt gratitude to Oncology Club to give me opportunity.